Good afternoon, and thank you for sticking with us for this hour of BNC Live. I'm Brittany Jones. I hope you are enjoying your Labor Day, folks. I'm in for Tashani Whitlow. We begin this hour with the latest on the coronavirus pandemic. The United States is averaging more than 150,000 new COVID-19 cases a day. And given the elevated rates of community transmission in nearly every region of the country, that number could rise once the Labor Day holiday wraps up. Millions of Americans hit the road this holiday weekend, and millions more travel by air. The latest numbers from the TSA shows more than 5.3 million travelers passed through security checkpoints between Friday, Saturday, and Sunday. Then there's the return of college football. Thousands of fans also packed into stadiums this weekend. No social distancing, hardly any masks, cheering on their teams. So here with me now to talk about this is Dr. Geoffrey Mount Varner. He's an emergency room physician and decisions expert. Good afternoon, Dr. Mount Varner, and welcome to BNC.
Brittany, how are you? And thank you for having me.
Yes, I'm doing good. So, Doc, what goes through your mind when you see those large crowds? You're talking about football games or wherever people are having these big parties, you name it.
What goes through my mind is that we are about to experience a large increase. If we walk back since this COVID crisis has started, after every single holiday, we have experienced a sudden surge. Now combine it with things that you just mentioned, which are now we have college football filled with large people, filled with large amounts of people, many of them not wearing masks. And so we're about to experience a large increase in about 14 to 17 days.
Wow. I mean, and when you hear those numbers, I know we already kind of brace ourselves for it, but at this point in looking at the number of deaths, it's definitely difficult to hear. So some would argue that those football fans were outdoors, so science would suggest that the risk of getting infected with the virus is low. Are they right about that?
Well, that is an interesting point. This time last year, they were more right. But don't forget, we are in the midst of a Delta variant surge. And what we've learned about Delta is that it is more infectious, which means it's easier for someone to contract, combined with the fact that it multiplies faster. All that means is that the closer you are in contact with anyone, especially unmasked, puts you at greater risk than, say, when you're in close contact with someone with the original strain. What we know for sure is that while they're outside, being outside comes with risk.
Yeah, and I mean, I just imagine still yelling and spitting and all that type of stuff going as you're cheering for your team as well. So what about this? Are hospitals preparing for a post-holiday surge? You just mentioned a moment ago that they could be. Do they even have the capacity to prepare given the current surge when many are at capacity already?
Brittany, that is an excellent question. I think the answer is it depends. If you are in a part of the country that's not experiencing a surge now, then the answer is yes, they are preparing for a surge. But if you're in that part of the country where you're already experiencing a surge, there may not be capacity in the system, which means that care at the end of the day is going to be compromised. Here's why. You have the COVID, you've got the COVID surge, but people need to keep in mind that the same diseases that existed prior to COVID still exist, meaning heart attacks, strokes, surgical emergencies, trauma. So you have an overwhelmed system still dealing with the old disease processes and now this surge. So some parts of the country, they are about to be compromised as it relates to emergency care health.
And Doc, when do you start seeing that wave after like a holiday weekend? How soon after do you see that surge come about?
Well, great question. Being a practicing ER doctor, who this will probably be my 6th or 7th surge, it usually starts to happen about the 10th to 14th day. Science says about the 7th, but about the 10th to 14th day, within the ER, we will start to see an increase in the number of patients. We'll start to see an increase in the number of hospitalizations, and that leads to an increase in the number of ICU admissions, and unfortunately, an increased number of deaths.
Yeah, that is definitely unfortunate. So at least 1,000 K through 12 schools across 35 states have been reportedly closed for in-person learning because of COVID-19 since the beginning of the school year. As more schools prepare to reopen, could we start to see more closures?
I've got to say that we will absolutely unequivocally see more closures. The science is very clear. The model has shown that schools that do not have a mask requirement or a twice a week testing policy, about 75% of those students at least will contract the COVID variant within the first 3 months. 75% of the entire school. Hence, I think we are about to see a large increase of school closures.
Wow, it just makes me so concerned for my little nieces and nephews and everybody's babies out there. So Dr. Varner, Mount Varner, what should the U.S. start doing now to possibly prevent more closures?
Well, at the end of the day, that is a great question. It's to do what we've already been talking about. Wearing your mask, wearing your mask, wearing your mask. And if your child has symptoms, don't send them to school. I know it seems easy. I have children too, but this is not like the old days. Your child had a slight cold and you couldn't take off work, and so you sent them in anyways. Now, if you do that, this could have deadly consequences for another family. In other words, wear your mask. If your child's not feeling well, leave your child at home. And lifestyle means everything. I mean, healthy living, eating right, plenty of sleep, making sure that you maximize your immune system.
And are we at the point where many have suggested that we must learn to live with COVID just as we had to learn to live with other viruses like the flu and anything else?
Brittany, that is an excellent question. If you listen to the tenor and tone of many of the experts now, if you read inside of the lines of what they're saying, it sounds like we are reaching a point where herd immunity will not be reached. And what that means is, it means that vaccinated as well as unvaccinated are very likely to contract this virus. Now, the studies are also very, very clear. If you are vaccinated and you contract the virus, you have minimum risk. If you're unvaccinated and you contract this virus, your risks go up astronomically, not just against death, but against strokes, clots. So again, we are back to this, to the regular point. Being vaccinated in this unique and one-time space we are in is extremely important.
Well, Dr. Mount Varner, we've got lots more to talk to you about after this short break, so stay with us. We have more stuff coming up. He will be talking about the latest on the newly emerged Mu variant. Nearly 200 cases have been recorded so far in Los Angeles County. We'll tell you what you need to know about it and how concerned should we be. BNC Live returns in just a moment. The United States is getting closer to 650,000 COVID-19 related deaths. That's according to Johns Hopkins University. This comes as some hotspots, including some in the Southeast, are seeing record numbers of patients in the hospital with the coronavirus. John Lawrence reports.
While millions of Americans are celebrating this Labor Day weekend, there are concerns increased travel and large gatherings could spark another COVID-19 surge. And hospitals in some states are already overwhelmed with patients.
We are setting case records. We have a record number of Kentuckians in the hospital battling COVID, in the ICU battling for their lives.
More than 99,000 people in the U.S. are hospitalized with COVID-19, according to data from the Department of Health and Human Services.
Some of it has to do with the fact that there's been tremendous disinformation campaigns and people are believing things that are simply not true.
Health officials are keeping close watch on another variant called Mu.
Right now, it is not an immediate threat.
Federal regulators are considering the possibility of authorizing a booster shot within the next few weeks. Dr. Anthony Fauci told CBS that the White House would probably roll out at least part of its booster plan the week of September 20th, but the vaccine plan will have to get approval from the FDA and sign off from the CDC first.
The good news about our vaccines, if you get the level of antibody high enough, which boosters actually do, then you can feel pretty confident that you're going to be protected against virtually any variant.
And Dr. Geoffrey Mount Varner is back with us to continue to talk about the latest on the pandemic. He's an emergency room physician and decisions expert. Doc, thank you for sticking around with us. So let's talk about the Mu variant. LA County has recorded more than 160 cases. Dr. Fauci says it's not an immediate threat, but what should we know about this variant?
What we should know about this variant, and thank you very much for that question. It first appeared in Colombia back in January. We've seen it appear in about 39 different countries. We have about 167 cases in LA and about 2,000 cases in this country so far. We know it's more contagious, but we don't know whether or not it is more deadly. What we do know is that it's a variant of interest. What that means is there are several variants out there, but this one has shown us enough where we are watching it to see if it's going to become the dominant strain. There's some data out there to lead us to I think it may not be as effective against the vaccine as we once thought. But there's a lot more information to find out.
Does it seem like it matches up to the Delta variant so far?
Well, that is a great question. If you just look at the data coming out of Colombia, it does not appear to be spreading as fast. But don't forget, the Delta variant was identified in October of last year, and it took about a year for it to reach where we are now. So I would say it's still a little early to figure out where mood is going to really take us.
Yeah, it's actually scary to hear that too. So are you concerned about the rate of how the virus is mutating, especially since some health experts say it's vaccine resistant, like you just said?
Well, the rate is, well, viruses do what viruses do. Viruses mutate.
Right.
What's concerning about this one is that as it mutates, it is creating a vaccine escape, meaning that that our vaccines don't appear to be working as well. However, given that we've now figured out that a booster shot, a third shot, or maybe a second shot if you've taken Johnson & Johnson, will give us a lot of protection against these various strains. And while we don't know about Mu, but we definitely know that it gives us greater protection against the Delta strain.
Mm-hmm. And Doc, what does the COVID-19 fight look like in the fall and winter? I know this was a big concern last year, and here we are still in the pandemic again this year.
Well, you all know me, and your audience knows me. I've been on your show several times, and I am forever the optimist. I just want to say that this is going to be a very difficult winter. It's going to be a very difficult winter compared to last year. Why? Kids are in school. You have these sporting activities going on, and then you have the Delta variant, which is more contagious, and you still have 43% of Americans who are not vaccinated. And by the way, the bulk, some studies are showing that only up to 35% of Black Americans are vaccinated. So if you're not vaccinated, this is going to be a very scary and difficult fall and winter season. If you're vaccinated, while it's going to be concerning, it won't be as scary as those who are unvaccinated. In other words, people just need to prepare for a different fall and a different winter than what we have experienced many years ago.
Yeah, and Doc, I've just looked on my timeline all across social media. You just see rest in peace, rest in peace. Some people saying get the vaccine because they keep having to post rest in peace. And so the Biden administration says Pfizer is on track with the booster shot rollout for the week of September 20th, but it appears Moderna may be lagging. Is it a significant concern that the rollout may not happen simultaneously?
It's not a significant concern as long as Moderna happens soon. But I think that just as long as those people who are eligible for the booster for the Pfizer, they get it when it's time, and we're going to be hopeful that the Moderna third dose will come soon. Otherwise, I think you're going to see our federal government experts come up with some different alternatives. But it looks like Moderna will be ready soon thereafter.
And how much does an uneven rollout create for the opportunity for mixed messaging? We know some people have already said there are reasons why they don't want to get vaccinated because they keep hearing different things.
Yeah, I think that that's a very good question. Yeah. It creates a chasm for the mixed messages. But I've done enough shows, I've spoken to enough people, I've taken care of enough patients to know that those folks who are hesitant now, it probably has less to do with missed messages, more so with them needing to just pursue and look into accurate and reliable information. Because keep in mind, we have over 50 million people who have been vaccinated. So there's enough data that if someone really wants to get vaccinated, they can look forward and say, hey, it's safe, and this is the safest alternative to making sure that I protect me and my family and my kids. And the reason why I say that, most kids at this stage who contract the virus, they contract it from an adult, and it's often the adult that they live with. So getting vaccinated helps your whole family.
But when the people in the Black community hear this and they talk about the mixed messaging, does it have an impact on them to decide not to get it? What do you think about that?
I think, in fairness to them, it does. And here's why. Historically, the medicine has maybe not have not messaged things well to the Black community. We have a lot that we've got to prove to the Black community. So the mixed messages definitely presents a conflict. But the Biden administration really wants to put their efforts on Red Bull, send messengers that look like them out to their community. Do what you all do. Put people who look like the community and who are part of the community to go out and talk and share the right message. And I think that would give us the biggest bang for the buck.
That's very important. And so, Dr. Biden administration announced Friday a $65.3 billion plan to prepare for future pandemics. What are lessons from this current pandemic that helps us plan for any future ones that we can't see right now, but we know one day is coming?
Lessons. You just mentioned one. One of them is messaging. And most importantly, it's if you reach out early on to the least of these, meaning those who are most vulnerable. If you take care of them, then all boats float in a rising tide. And so what we can do is work on messaging, work on leadership, and make sure that we poignantly target those vulnerable populations, and we already know who they are. And to your point, there will be another crisis coming. There will be another infectious crisis. So hopefully we will take these lessons, learn from them, and implement them so that we can protect us all.
From your lips to God's ears, let's get these prayers in for the future. Dr. Mount Varner, thank you so much for your time today.